push my knee down into the slider, and then I drive it straight backwards like this. You go far enough back, you'll start to feel the pull on the front, and you're definitely going to feel your glutes and your hamstrings engage. I've got a lot of patients, a lot of people out there who are complaining of tight hip flexors. They've got this feeling of tension, tightness, restriction, whatever, in the front of the hip. And, they try all these stretches, and I've got some on my channel, half kneeling hip flexor stretches, and it might give them some temporary relief, but it never really permanently stays that way. I'll say the number one thing, if I have a patient or anybody that's got tight hip flexors or hamstrings, whatever, I like to apply load. So I want to strengthen the muscle. Usually I think that's the problem. They're weak and we're overutilizing them, and then we start to have these symptoms. I've got other videos on my channel that directly target your hip flexors, specifically your psoas. Go ahead and give those a try, see what you think with those. In this video, we're going to try a little bit of a different approach. We're going to use a concept called reciprocal inhibition. So basically what I'm going to do is drive my hip into extension using my glutes and my hamstrings. So I'm using the opposite muscle group to lengthen the front side of my hip. Tell me what you think, and let's get into it. What you're going to need are two sliders. So one goes under the knee, the other one goes under the foot. I usually will use something for balance at first for people, maybe a table. And I'm in this half kneeling position, common area that we start to stretch the muscle. But what I'm going to do is get my core engaged. Really important that I tuck my pelvis, pull my ribs down, core is engaged. And then what I do is I squeeze my glute and I push my knee down into the slider, and then I drive it straight backwards like this. You go far enough back, you'll start to feel the pull on the front, and you're definitely going to feel your glutes and your hamstrings engage. And I bring it back up. Again, lock in, push, 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 then back up. A couple things to avoid. Same thing with stretching the hip flexors. If you start to break through the spine, you might feel a stretch there, but you're getting most of the motion through the pelvis, where I want this thing to stay locked in and then just get pure hip extension like that. The other reason why we don't want you to dump forward is then at that point, there's little to no glute or hamstring activity, which makes this particular exercise pointless. Common things that people will struggle with, I think, with this, depending on if you're wearing pants or not, or the type of sliders or the type of carpet, is the slider will slide out, or it's hard to keep it under the knee specifically. So that's why you really got to work on pushing that knee down, and I'm also pushing my foot down. So it's not me just using momentum to slide back, it's me contracting back here to get that leg backwards. You can progress something like this. I can use a resistance band. So if I had a resistance band anchored in front of me, wrapped around here, now I'm pulling against something, that would be worth trying. But it's not complicated. I just do several reps. I don't really count. I just go until I feel like I'm fatigued, which I'm getting close. So there you have it. So a little bit of a different way to work on things like tight hip flexors. Let's get our glutes going. Let's get our hamstrings going. Let's focus on extension of the hip rather than hip flexors, if that makes sense. So let me know what you think. And I'll